Good afternoon, all. I will, share my screen in some moments, but first I would like to thank very much Terry, thank Firefly Innovations for this invitation and for this kind presentation. I was going to start exactly by that, by presenting a little bit myself. I see, let me make this note in the audience, some known names, so and also some Portuguese names. So we reached some Portuguese audience too. Good afternoon to all. Thank you very much. And well, while thanking for the opportunity to share with you a little bit the work that we are developing in Fraunhofer over the last 10 years, and that's what I proposed myself to do today, I would like also to clarify, and Terry already introduced myself and my path, that I will be doing it from a very much exact science engineering point of view, which is my own. I will try, of course, to transmit other points of view, the point of view of the wide and multidisciplinary research team that we have at Fraunhofer. Nevertheless, in the end, I will, of course, provide my contacts, also the general contacts of Fraunhofer, and you can, of course, for more information, contact us. If you want, I will go over several projects, several approaches, but if you would like to have more information in a specific project, please contact us at any time and we will transmit this to you gladly. So I will start by sharing my screen. So it tells me that it is. Let me just check what's happening. My presentation froze, as it has to be. Yeah. You cannot see my presentation at the moment, or no?
Not yet.
Not yet, yes. It's because it was open and sharing, but it froze. So let me go again there. Come back. Okay, now it should go. My apologies. It's here.
Yes, now it's starting to share.
Now it's shared, and in some moments, as soon as this replies, are you seeing it in full screen? No.
Not yet. You just have to click full screen from here.
Yeah, I'm doing it, but it's not answering to me.
Ah.
Yeah. Wait a minute.
Oh, that's okay.
Ah, now it is.
Always these sorts of challenges, and now it's perfect. Thank you so much.
Thank you, Alessandro. Very much, so, very well. So while preparing for this challenge that was brought by Firefly, I thought about a little bit about the path that we've done at Fraunhofer over the last years on this topic of healthy aging, on this topic of the future of healthy aging, which is the one that we are discussing here today. And the question that led all the presentation that I have in front is very much, is there a better future for healthy aging? This was also one of the questions that led us to rethink our strategic agenda very recently, 2 or 3 years ago, in here at Fraunhofer AICOS. And I will start in a way that it's different than I normally do. So I will start by the past and then give you some insights on how we see this future of healthy aging and how we are preparing for what it's coming. I don't need to introduce the topic. We all know the difficulties, the challenges that are related with healthy aging. We know that the number of citizens over 65, over 80 years old is growing. In Europe, it is predicted that in the next 50 years, the number of citizens over 65 will increase 2 times. The number of citizens over 80 will increase 3 times. And while these are very good news, we are living longer. That doesn't mean, of course, that we are living healthier or that we are living in a more active way. And this is, of course, the challenge that we have in front of you and that we would like to address and that we would like to facilitate. Over the time, we have addressed this topic by focusing not exactly on health or meaning on age, but on the health that is related with this aging. We have developed a lot of solutions to tackle chronic diseases, to increase the sustainability of health systems, understanding the weight on healthcare costs that this diseases, this aging, brings to our systems. And this is also has been, as you know, the focal point of a lot of discussions, some of them, for instance, in the European Union, understanding the increase on the number of retired people, the shrinking working age population that we have, and the burden that, of course, this will bring not only to the welfare, to the health system, but also the economic burden that this will bring by reducing the amount of persons, the workforce that is available to industries, to companies, a situation that we start already seeing while talking to our partners in industry and to our customers, for instance. So we approach this by developing solutions that are community-based, focused, of course, on wellness, on healthy aging, on tackling chronic diseases, but also, and more recently, by understanding the challenges that are posed to these people in, for instance, the workplaces, in during our work activities, and understanding how technology can support these tasks. I'm talking about we, us, we talked already about Fraunhofer shortly. Terry introduced very shortly Fraunhofer. We talked about AICOS, but I would like to bring you and start by that, by introducing with a little bit more detail what is this a Fraunhofer and what is this a Fraunhofer in Portugal. So starting by that, Fraunhofer is in Portugal, is coming from a big institution. This institution that it has its origin in Germany, Fraunhofer Gesellschaft. It's an applied research institution. You can see that it has more than 80 research units, 74 institutes, and these numbers are only for Germany, okay? It works in several areas of engineering, as you can see in there, innovation, ICT, as we do in AICOS, materials, components. It has over 28,000 employees and works every year with a budget of 2.8 billion euros, from which, and this is very important because it shows how and the main purpose of Fraunhofer, from which 2.3 come from contracted research. This means that 2.3 are related with solving problems within projects that clients bring or partners bring, that are, of course, dedicated to increase our knowledge, our competencies that will then be applied in real world problems. It started in Germany, but it rapidly evolved all over the world. This is the current situation of Fraunhofer presence in the world. Outside of Germany, so you can see that it has different kind of representations, can have subsidiary centers, project centers, offices. In Europe and outside of Germany, Portugal, together with Austria, were the two main locations that were created. So the US actually was the first, and then after that, Portugal and Austria were created more than 10 years ago, that we are in here, initially in Porto, and now also in Porto and in Lisbon. We are a non-profit research institution of public common interest. This is important also, very important to us. We have as founding associates the Fraunhofer Gesellschaft, the German institution, and the Portuguese-German Chamber of Commerce. This also notices very well the focus that we have in real applications, in bringing and transferring our technology to the market. This connection, this partnership with the German-Portuguese Chamber of Commerce. And we have two research centers at the moment, AICOS, the one that I come from, Assistive Information and Communication Solutions, comes after a partnership with the University of Porto and focuses on ICT. I will talk more about this, of course. And we are launching a new center, AVAM, which stands for Agriculture and Water Management. And this comes in a partnership with two universities in Portugal, one in the north, another one more to the south, that are very much focused on these topics of agriculture and water management. Coming to AICOS, we envision a future. We envision a future in which we are present, that we also propose, but we focus our work on this future and the impact that our technology will have in the lives of people. So our research is very much based on end user insights. We work very close to the end user. And our mission, as you can see in there, is to develop, yes, remarkable technology, easy to use, meaning that we do our development and we contribute to the success of our clients by understanding very well what are the needs and how to answer the needs of the customers of our clients, the end users. So those are the ones that we study mostly when we engage in the development of a new technology. How do we do this? We normally say that the secret, the recipe to our approach is dividing every problem into three perspectives. And these are the perspectives. The first is looking at people, understanding their needs, their habits. And then we include another layer, a layer of things and how these things adapt to people. And then a third layer of intelligence that supports this. With this, together with this network, we have a strong focus on having researchers that can build this trust relationship with the users that are being involved in our activities. And we put a lot of effort, a lot of focus on this. And it's also a very important characteristic of the research team that we have in here and that we nurture a lot. And we have used this network to develop several technologies in a wide variety of application areas. You can see in here some of the portfolio of technologies that we have developed over the years. We have this capacity of sensing, of developing sensing technologies that allow us to acquire data and then connect this data in order to develop a set of solutions in this variety of applications. And some of them are more related with the topic that we are in here discussing. And I would like to enter very briefly in three of these areas that are the nutrition, the motion, and the personal, to give you some insights of what we have been doing over the years. And I chose this because, of course, one of our approaches to aging is multidimensional, of course, as aging is. And we understand that it is this approach that will bring the value that and the impact that we are looking for. And so in the nutrition area, we have developed several projects, mostly related with meal recommendations, with shopping assistance. And we came to this topic because we understand that, well, when people make food selections, choices, they have a lot of restrictions to meet, right? And these restrictions are sometimes contradictory. So we have budget restrictions, for instance, that lead us to neglect the nutrition. And we understand that this malnutrition has severe implications, as you can see here. Some of them are here listed. We know that, for instance, 1 in 6 seniors in the US reaching the emergency room are actually malnourished. Okay, so this is a topic that is extremely relevant. Poor nutrition weakens our immune system, as you can see in there. Good nutrition, on the opposite, can of course help preventing chronic diseases. And like a nutritionist assistant for users. So with the system, the users can plan the meals, but also can plan the shopping, okay, by combining several sources of information. We can combine the nutrition, the food composition. We can include information, for instance, on the body data of the user, food preferences, food restrictions, data from retailers. So helping balancing these different criteria and reaching. So as I mentioned, there are often. Yeah, fine now. Reaching a solution that, of course, is personalized and help people achieve healthier eating habits. We have developed other projects related with this. Cordon Green, the one that you see in here, is an example, but we have others with national and international, European mainly, partners that allow to adapt to the specific needs of the culture, of the country that we are looking, or the retailer, for instance, that we are working with to help bringing the solutions to the market. One of the oldest portfolio of Fraunhofer AICOS, very much related with the topic, is motion. So the capability of processing data from inertial sensors to recognize human activity and characterize movements. We have been studying this area since 2008, so human motion, in free living conditions. Since then, we use initially inertial sensors from the smartphones that we all have, and we use these signals that the sensors provide to understand if a person is moving, if it's static, if it's sitting, if it's walking, if it's standing. We are even able to detect the step, measure the length and the direction of the path, and combining this information, for instance, with the environmental sensing data, we can understand where the person is located, for instance, for indoor location, for indoor tracking. We are also able to detect anomalies in these signals, for instance, as high impact that have occurred, like, for instance, a fall. We have developed algorithms for this based on simulated falls from our volunteers, that in which we obtained, as you can see, 97% of accuracy, but also in real world falls with an accuracy very similar to this. And these algorithms are in fact available in the market. I will show to you a solution available in the market that combines this several competences that AICOS has. And well, by understanding the growing market of wearables, we are also able to take out these technologies from the smartphone and develop it through inertial sensors that can be attached to your body in fixed positions and allow to extract a wider span of features, of metrics from the signals, and characterize movements with more detail. You can see, for instance, in here, metrics from physiotherapy sessions, for instance, or we can do also with this analyze the patterns of repetitive movements in factories, for instance, in manufacturing workers, understanding, of course, for instance, the functional status of a patient groups, as you can see in here. You can see in a daycare center, for instance, promoting the cognitive stimulation and social interaction. So also one of these dimensions related with health that I had mentioned in the beginning. What is extremely important to us while developing this technology for management, self-management of chronic diseases for all these conditions related with aging, is that we ensure the availability of highly usable interactions. I already mentioned that. The visualization of information about the person and about the activity is very important. The visualization of information that helps persons take decisions. And we focus that in developing assistant technologies that help the person to self-care chronic diseases. So what you see in the image is an example of a product that is actually in the market developed with us. I will present that. But in fact, self-care is one of the most important approaches that we have to this healthy aging, to the future of healthy aging. And we understand that technology is there to help. Technology has a huge impact on this. But while designing it, while developing it, we must ensure that it meets the needs of the user. It facilitates this positive impact that we are looking for. And so we bring to our technology a lot of concerns, namely concerns with statics, as you can see in the image, but also concerns of avoiding discrimination, avoiding a lot of other situations. And we use, of course, our human-centered design methodologies that I briefly discussed to ensure this. And I mentioned several times the fact that we have some technology that is in the market. And in fact, this that you're seeing now in the screen is one of the first items of our portfolio that we managed to put in the market and to make other people happy, right? So this is the purpose of what we developed. It was basically, it is a solution that consists in 3 components. I will describe them in front, but as you can see in here, we have in the image, you can see the result of the interface, the mobile interface that was in fact a development that was done together with hundreds of people over hundreds of usability sessions, interaction sessions with users that allowed us to come up with a solution that was indeed directed to the specific needs of this audience. And basically, this Go Live is composed by 3 components. So a clip that you can see in there, Go Live clip. So it is a sensor that collects data regarding the user's physical activity. It detects falls, and it includes an alarm button for emergency situations, of course. And this clip interacts with the Go Live app that you can see there in the smartphone, in the screen of the smartphone, which was designed with this senior user's needs in mind, in terms of usability, in terms of features, and it provides a fall prevention program, including activity monitoring, using the data that is collected from the clip or the smartphone. It allows to calculate the risk of falling, and it includes also a fall detector. And it allows, of course, the person to be in control and in connection with the family and friends. And then it has a Go Live Assist, which is the web platform available for the authorized caregivers that receives the data from the phone, Go Live phone, and allows them to be informed about the well-being of the Go Live clip user. So I mentioned this already. This system was developed using a user-centered methodology applied during the development, during hundreds of sessions with users in Portugal, in the Netherlands, which is the country in which it is being commercialized, and allowed us to develop a project that was indeed developed by the final users and tackles their real needs. And this brings me to, so I've described a little bit our past activities. These are also very present, but these are activities that we developed over the years, over the last 10 years. But the name of the session is indeed the future of healthy aging. And I would like also to provide or to share with you some of our views of what will be this future of aging, or active aging, or healthy aging, and how do we see this. So we have, while we celebrated 10 years, we have done in here an effort of understanding what will be our future areas of impact, future areas of application. We call it innovation areas. And one of the most related to this, we call it decentralized health solutions. So what we understand, health technologies, So we understand is that, well, the health systems are very much focused on treating acute conditions, on managing health issues in a fragmented area. So with silos, and this of course has impacts in the healthcare of the elderly population, but not only, of course. And so we envision a shift from the so-called ambient assisted living to a continuum of health that is focused on healthy living, on prevention, on early diagnosis, okay? And this shift also from an healthcare that treats in an episode, so an episode of health that is focused on volume, that is fragmented, into a health system that is focused on value, on an integrated and multidisciplinary approach. And this approach is very much related with a decentralized solution, which allows the communities, the several actors, to be involved in the healthcare process, to take the health care from the hospitals and let it be involved also in the community. And some of the examples that you've seen here in the images are some solutions that are developed using the competencies that I already described before. Mobile embedded sensing technologies that allow to develop high performance, low cost portable solutions that can be used to go to the people, in the direction closer to the people, to the communities, and bring healthcare to the point of care. Other innovation areas that are related with this, we understand that artificial intelligence and most of the solutions that are developed nowadays are based on artificial intelligence. We cannot run away from it, and it has huge impact and enormous value on what will be the future of health. However, we envision an artificial intelligence that is accountable, and most important than that, an artificial intelligence that allows the users of these solutions to trust the system that is being developed. So we need solutions that are explainable, that are unbiased, that are transparent, that allow the user to trust the support, the technology that is being used. And also related to this area, we have other innovation areas, but we are also very much focused on studying how people live and how people age with data. So understanding how people coexist with data. And this are done through longitudinal studies that allow to understand how people make decisions, what motivates them, how they manage their lives with the devices and data. So we want, of course, to be able in the future to understand better which are the needs, what are the best solutions by understanding and studying together with the users in long-term studies how these devices are used. To finalize, and to give this idea of what is the future from our point of view, I would like to also give you an example of a project that has started very recently. It's called Operator. And it's a project that involves all the three teams that I mentioned before, also all these competences of people, things, and intelligence. And it's a project developed together with an automotive industry, a car factory, and a textile industry. And it's focused, of course, on productivity. We are talking about factories, but productivity from a people point of view. So it is focused on people, on the workers of the factories, and it joins the two main components of ergonomy and mental health. And I bring this because, of course, one of the main topics of the future of aging will be related with the future of aging in work and how we create conditions for people to be more active and longer active. And so in this project, we are using sensing technology, but mainly, again, focusing on self-report solutions, which allows the people to report and to understand how is their health, their mental health, their physical health. And it's being developed through participatory design approaches. What you can see in there in the image is one of our colleagues positioning sensors in one of the workers. And you can also see the workplace of one of the workers, the tools that they use to design. So this is to develop their work. So this is, of course, parts of this process, which has unfortunately been a little bit delayed by COVID. Of course, we have limitations in going to the factories and interacting with the users, but we find alternatives. And in these examples, of course, are some of the methodologies that we use to understand the challenges and the real needs of the users in the scenario, in the real world scenarios, and how technology can be used, how technology will be used. That's very important to understand in advance how technology will be used, what are the limitations that we will encounter in the real setting, and of course to gather some quantitative measures that will allow us to better inform or to allow for better decisions to workers and managers of these institutions. So at least in my view, and as I already explained, this is very much related with the future of aging, the future of active aging, and creating conditions for staying longer active in their real world environment. To finalize, one last note. I mean, we are living in the pandemic, and if there's one thing that this pandemic has shown is that the importance of the people in involvement in creating healthy environments, healthy relationships, in building social awareness of health needs. And of course, I would hope very much that we use this new game attitude to improve care, to create conditions for innovations, to have real impact in the life of people and reach their final goal and of developing a better world. So from my part, I thank very much once again for this opportunity and for all that are listening, and I'm very willing to answer all your questions. Thank you very much.
Thank you, Liliana. Thank you so much. So we don't have a lot of time, so I'm going to try to summarize some of the questions that our audience has posed. I think a first bucket of question kind of relates to any sort of measurement that you have observed in terms of clinical and health outcomes from any of the projects. And if you could just maybe give us one or two quick examples, that would be great.
Terry, I'm sorry, the examples of, I didn't understand.
Like in terms of clinical and health outcomes. So from any of the products that you shared.
Yeah,
thank you.
Yeah, so from this last project that I've showed you, you can see that we are more and more having, giving importance to the mental health, the impact on the mental health of the people. So these are some of the outcomes that we are aiming. I mean, reducing stress, of course, and ensuring that people have better conditions while working. But most of the outcomes in terms of clinical and health are, of course, related with the reduction of injuries. When we talk, for instance, about ergonomy, the reduction of disabilities, of injuries, for instance, in falling, which is also one of the main outcomes of the solutions that we are developing. If we go to the nutrition, of course, we are aiming for better nutrition and better health. So I don't know if this answers specifically.
Yeah, I'm just wondering if have there been any published studies testing on some of these products? Maybe what we can do is to get some links from you and push them out to the audience.
That's perfect. In the presentation I had some links in there, so.
Okay, great. So just in the interest of time, we'll let people follow up on some of the readings. Another really interesting question from Ricardo is sort of the extent to which clinical providers are involved, I think in both the design as well as the implementation of these technologies.
True. We have, for instance, in the Smart Pit project that I was talking about, we had some cardiologists that were actually employed in Fraunhofer and working with us. Okay, so and they work from all the phases, from, of course, the expert knowledge that only them have, and that's obvious when we want to build inference and develop solutions that can, of course, automate decisions. We need this expert knowledge, but also on understanding which are the real problems of their patients. And this involvement of the experts is in all the phases of the research and development. Great.
Another question from Ricardo relates to the use of smartphones among seniors. This could be a limitation. What are your thoughts on that?
Of course. And so we approach that we are perfectly aware of that, and we approach that from two sides. One of them is, as you saw in there, by removing the sensors that we have in the smartphone to other devices that we all know that we arrive home and we put the cell phone on the desk and we don't walk around in the house with a smartphone. So taking out the sensors out of the smartphone and developing wearable devices that can be used is one of those approaches, of course. But from another side, we also understand that more and more seniors have indeed smartphones. So we focus on the other part, which is to develop interfaces that is the utilization of these devices.
Great, thank you. One last question, the role of the investors in terms of, I know that you guys are doing more and more of the sort of commercialization process. Who are the kinds of investors that you have encountered or that you see being interested in these products? And have you also applied these products to different types of senior housing environments, both within their homes, but also in more sort of established institutionalized settings?
Correct. So starting by the last one, yes. So in this network of users that we have not only individual persons that are involved in this developing an assessment of the technology, but also senior homes, institutions, elder care, daycare associations that support and work with us. When you talk about investors, we have mainly projects with companies. So that's our main way of working. So we have technology companies, startups that work in this area of health and are mostly and need the technological capabilities and all the others to develop their solutions. We are, as you know, more and more investing in this area of ensuring that our technologies make their own path with our support, but very young still.
And it seems like industry partnerships are sort of like established at the outset to support kind of a seamless transition to commercialization.
Exactly, as you saw, for instance, we have this partner that I described is a partner from a company from the Netherlands that has approached us, interested in these technologies and then takes the technology to the market.
Great, thank you so much, Liliana, and thank you for all the questions from the audience.